COVID-19, tips for prevention and personal protection. Learning objectives. At the completion of the module, learners will be able to list the symptoms and discuss the methods of transmission of coronavirus 2019, also known as COVID-19, explain the steps that can be taken to prevent infection with the virus, describe the importance of proper disinfection techniques, social distancing, and the use of face coverings. Discuss the district's COVID-19 policies and procedures, and where to find information about your COVID-19 leave benefits. How the virus spreads. How does COVID-19 spread? COVID-19 spreads very easily from person to person. COVID-19 most commonly spreads during close contact. People who are physically near, within 6 feet, of a person with COVID-19 or have direct contact with that person are at great risk of infection. Close contact is 15 minutes or more over a 24-hour period of time with or without a mask. When people with COVID-19 cough, sneeze, sing, talk, or breathe, they produce respiratory droplets. These droplets can range in size from larger droplets, some of which are visible, to smaller droplets. Small droplets can also form particles when they dry very quickly in the airstream. Available data indicates that it is much more common for the virus that causes COVID-19 to spread through close contact with a person who has COVID-19 than through airborne transmission. COVID-19 spreads less commonly through contact with contaminated surfaces. Spread from touching surfaces is not thought to be a common way that COVID-19 spreads. COVID-19 may also spread by people who are not showing symptoms. These cases are known as asymptomatic. Risk factors, signs, and symptoms. COVID-19 risk factors. Based on what we know now, those at high risk for severe illness from COVID-19 are 65 years and older, or those living in a nursing home or long-term care facility. People of all ages with underlying medical conditions, particularly if not well controlled, including chronic lung disease or moderate to severe asthma, serious heart conditions, severe obesity, having a BMI of 40 or higher, diabetes, chronic kidney disease undergoing dialysis, and liver disease. People who are immunocompromised are also at great risk. Many conditions can cause a person to become immunocompromised, including cancer treatment, smoking, bone marrow or organ transplantation, immune deficiencies, poorly controlled HIV or AIDS, and prolonged use of corticosteroids and other immune-weakening medications. COVID-19 symptoms. COVID-19 symptoms may appear 2 to 14 days after exposure to the virus. People with COVID-19 may experience a wide range of symptoms, including those below: shortness of breath, difficulty breathing, fever or chills, cough, fatigue, muscle or body aches, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea, headache. What should I do if I show symptoms? It's important to isolate yourself if you begin to show any of the COVID-19 symptoms. Do not come to work if you are sick. Talk to your healthcare provider if you begin to show symptoms. Your healthcare provider should be able to advise you where and when you should take a COVID-19 test, as well as additional steps to help you isolate while you may be infectious. Personal protection, preventing infection. Wash your hands often with soap and water for at least 20 seconds, especially after you've been in a public place or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hand and rub them together until they feel dry. It is important to note that hand sanitizer is not effective on soiled hands. Make sure your hands are clean prior to applying hand sanitizer. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick, even inside your home. If possible, Maintain 6 feet between the person who is sick and other household members. Put distance between yourself and other people outside of your home. Remember that some people without symptoms may be able to spread the virus. Stay at least 6 feet, about 2 arm lengths, from other people. Keeping distance from others is especially important for people who are at higher risk of getting very sick. Cover your mouth and nose with a face covering when around others. You could spread the virus without feeling sick. It's important to note that particles containing the COVID-19 virus can travel more than 6 feet, especially indoors. So we must incorporate all control techniques, including social distancing, face covering, and frequent hand hygiene to effectively guard against transmission of the virus. Face coverings and masks. Everyone should wear a cloth face cover when they have to go out in public. Cloth face coverings should not be placed on young children under age 2, anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. Masks help reduce aerosol transmission, but are not considered respiratory protective equipment. The cloth face cover is meant to protect others in case you are infected. The cloth face cover is not a substitute for social distancing. Maintain about 6 feet between yourself and others. Choosing a mask. Do choose masks that have 2 or more layers of washable, breathable fabric. Completely cover your nose and mouth. Fit snugly against the sides of your face and don't have gaps. Do not choose masks that are made of fabric that makes it hard to breathe, for example, vinyl. Have exhalation valves or vents which allow the virus particles to escape. Are intended for healthcare workers, including N95 respirators or surgical masks. Wear a mask correctly and consistently to help keep from getting or spreading the virus. Be sure to wash your hands before putting on a mask. Do not touch the mask when wearing it. Make sure the mask covers your nose and mouth and secure it under your chin, and that the mask fits snugly against the sides of your face. How not to wear a mask. Around your neck, on your forehead, under your nose, only on your nose, on your chin, dangling from one ear, or on your arm. How to take off a mask. Step 1. Carefully untie the strings behind your head or stretch the ear loops. Step 2. Handle only by the ear loops or ties. Step 3. Fold outside corners together. Step 4. Be careful not to touch your eyes, nose, and mouth when removing, and wash hands immediately after removing. If you are around others and do not have on your cloth face covering, remember to always cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow, and do not spit. Throw used tissues into the trash. Immediately wash your hands with soap and water for at least 20 seconds. If soap and water are not readily available, clean your hands with a hand sanitizer that contains at least 60% alcohol. Be alert for symptoms such as fever, cough, shortness of breath, or other symptoms of COVID-19. Take your temperature if symptoms develop, but not within 30 minutes of exercising or after taking medications that could lower your temperature, like acetaminophen. Follow CDC guidance if symptoms develop. Do not come to work if you are feeling ill or experiencing the aforementioned symptoms. Cleaning and disinfection policies and procedures. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces appear dirty, clean them. Use detergent or soap and water prior to sanitizing or disinfecting surfaces. Then, use a district-approved sanitizer. Contact your site's custodian to receive a bottle of the district's approved solution. It works effectively and is compliant with the California State Healthy Schools Act. COVID-19 cleaning and disinfecting protocols. As with past viral outbreaks, EGUSD's custodial department has adapted its protocols to include cleaning for health. focus on cleaning touch points and communal areas. A recent addition to custodial cleaning efforts is the use of stabilized aqueous ozone to clean and sanitize our sites. Aqueous ozone is an effective cleaning agent that leaves no chemical residue. COVID-19 policies and procedures. For a comprehensive look at EGUSD's policies and procedures, including the district's COVID-19 Exposure Control Plan, please visit this link, COVID-19 Policies and Procedures, for more information. The Exposure Control Plan outlines important information regarding work control measures, cleaning and disinfecting procedures, face coverings, social distancing, and our response and investigation process for COVID-19 cases. COVID-19 related leave benefits. Contact the EGUSD Human Resources Leave Desk by email at leaves@egusd.net or call 916-793-2955 for information on leave benefits that you may be entitled to receive if you have been exposed to or have contracted COVID-19. Additional information on COVID-19 benefits can be found at the California Labor and Workforce Development Agency. In conclusion, while there is no current cure for COVID-19 and vaccination efforts are underway, following the simple precautions provided in this presentation will reduce your risk of infection or transmission of the virus. This concludes our COVID-19 training video. Thank you for watching, and be sure to complete the corresponding quiz below the video. We've also included 2 short supplemental videos on using personal protection and cleaning with stabilized aqueous ozone for your information. We encourage you to view them for more additional tips on staying safe and protected while at work.